It's pushing the cartilage to the right. I get the instrument in over the top, and you'll see the instrument's going to come in right over the top. And once I've got the instrument in, then I can go towards the eardrum, then I can go to the left or the right or the top or the bottom of the ear canal. So stage one is to get the instrument in, which means the endoscope just has to be past the first bend, past the cilia, and then you can move forwards. So I hope the Earwax delegates, I know there's a couple of you that have, I promised I'll talk over it in a video, so I will email you the link to this video as well, so you can watch it back and listen to the description, and I'll explain the same again for the right ear. So that's the technique for the left ear. So you can see the eardrum's fully visible. There's a bit of vascularis of the ear canal, the blood vessels are dilated. That's because we remove all the wax. There's just a few remnants there, so I'm just going to get that off. So again, I'm stretching the ear back and up to stretch the ear open. I've got the endoscope in to keep the ear canal open. I then looked into the ear momentarily, so I wasn't looking at the moment I'm putting the instrument into the ear, I'm actually looking into the ear, not on the screen. I'm pushing the cartilage out the way using the fine end just to reveal the tip of the endoscope, and then I'm going down and over the top of the tip of the endoscope so I can ensure the instrument enters the ear safely without touching any of the canal wall. And once it's in, then I'm moving forwards. So there's just some keratin here at the base of the ear canal near the entrance. There's just some crusted skin there as well due to their psoriasis. The patient felt a lot better. They're gonna use some steroid cream at the entrance of the ear, and then inside the ear they're going to use some acetic acid spray just to help calm the ear down. And it is just a chronic problem. It's something that they have to manage. So that hence they come every year. So again, I'm going to explain the technique for the Earwax past specialists and delegates that attend the course. So in the case of the right ear, retracting the pinna back. So as you know, we pull that back and up, and that stretches and straightens the ear canal. And this ear is really bendy actually. Now, although the wax is in the distance, what I'm doing once I've retracted the pinna, I've inserted the endoscope into the ear just past that first bend, and you can see the ear canal is it's almost shut. So I've stretched the ear, you've seen that. The endoscope is now pushing against on the left-hand side. So I'm stretching the ear open on the posterior canal wall, and then I'm momentarily looking into the ear, and I'm angling the instrument downwards and over the top of the tip of the endoscope. And if there's any cartilage that's in the way, I'm using the tip of the instrument to push the cartilage away to see the tip of the endoscope, and I'm going directly on top. Once I'm in, then I can move forwards towards the wax. As you can see, now we're going forwards past the bend. So again, we're just going to repeat that. I'm stretching the ear open, as you can see, endoscope just past the first bend, and I'm actually angling it more to the left, and you can see that instrument came right in the middle. It wasn't towards the right or to the left-hand side of the ear canal, and it just ensures the patient's going to be comfortable. We're not risking catching the side of the ear canal with the instrument as we're inserting it. And when we perform earwax removal, patient comfort is paramount. We're going to make sure the patient is as comfortable as possible. So just managed to get this plug of wax out. It was quite dry and dead skin. You can see it's oxidized, it's quite dry. You can see the psoriasis patch just there. Very bendy ear canal, you can see the eardrum. It's just some dry skin around the edge. I'm just going to mop that up. So again, I'm stretching the ear open, over the top, and I'm just going to peel away. So this is on the cartilaginous portion, entering the bony part. When we're on the cartilaginous portion, we can apply a bit of pressure. The cartilage is flexible, it's not rigid like the bony part of the ear canal. The cartilage has got a thick layer of skin that sits on top of it, so it has like a buffer.